In medicine, breakthroughs are made every day, but it's in the field of women's reproductive health that researchers have made astounding strides. In the recent past, common procedures like hysterectomy, tubal ligation surgery, and pelvic floor prolapse surgery were major medical procedures. Today, minimally invasive techniques are drastically reducing discomfort and recovery time.
The minimally invasive procedures have significantly reduced the risk, the recovery time, the OR time from what it once was. And I think when we think in terms of our mothers undergoing hysterectomies or other types of surgery, it was a big deal. Now there may be 2 or 3 small incisions, some as small as 5 millimeters. It should still be looked upon as a major operation, but the differences are just enormous, and really all on the plus side.
One of the most significant developments has been the introduction of robotics in surgery. Robotic-assisted surgery allows surgeons to perform hysterectomies and prolapse support procedures with just a few minor incisions.
The Da Vinci surgical system, basically there are 2 components to it. One is the console and one is actually the robotic arms. The surgeon sits at the console, and from the console I'm able to do all of the surgery. Once the instruments are placed, I'm able to sit at the console and manipulate the instruments, and they mimic every single wrist movement that I do. So since we're making very small, distinct movements, we have less blood loss, less scarring, less pain. So when they wake up, generally they're a little sore. They feel a little bit bloated because we do inflate the abdomen so that we can see everything. But generally they take PO pain medications or medications by mouth, and they're up and ready to go home within about 6 hours after the surgery.
For patients like Belinda Curtin, the reduced recovery time associated with robotic surgeries is a huge benefit.
There's so many things you hear about hysterectomies and how painful they are and the recovery time period, and my mom was really ill and I just didn't have time to lay around and try to get better. So the doctor suggested that I do the Da Vinci hysterectomy procedure, and when I first heard that a robot was going to be giving me a hysterectomy, I was a little bit apprehensive, but it was a piece of cake. For me, it was a piece of cake. At 50 years old, it was just, I went in that morning, went out that evening, and no problems, no, maybe a little bit of soreness, maybe a little bloating, but I mean, like the next weekend, I was out shopping.
Another breakthrough is an office-based procedure called eSure, which replaces traditional tubal ligation surgery, commonly referred to as getting one's tubes tied.
eSure is a new procedure for permanent sterilization for patients, and it's a wonderful procedure for patients because the procedure can be performed in the office. There's no incision. The patient comes in the office, she's given a mild sedative, a local anesthetic is injected in the cervix, and then a microscope is inserted through the vagina, through the cervix, into the uterus. Small implants are put into each tube, and they ultimately scar the tube shut, creating the sterilization. The beauty of the procedure is local anesthetic, no hospitalization, and no incision needed. It's much safer for the patient. She can go back to work literally the same day.
Reproductive health is an issue for every woman. Never before have there been so many minimally invasive solutions for the health concerns countless women will face. We are truly a privileged generation. With 3 locations in Central Florida, the physicians of OB and GYN Specialists are on the cutting edge of women's reproductive health. Using state-of-the-art technology, these professionals are able to treat common medical conditions usually requiring major surgery with minimally invasive procedures. OB and GYN Specialists is helping to revolutionize the women's healthcare industry.
Our physicians that do minimally invasive surgery have done a lot of it, have become very skillful at it. As far as our outpatient surgeries that we can do in the office, most practices don't have that. In-office ultrasound imaging, we do a lot of that. So I think as far as providing cutting-edge care, if that's the proper term, I think we really have everything that someone could need.
OB and GYN Specialists offers today's latest advancements in reproductive health including robot-assisted minimally invasive hysterectomy, office-based tubal sterilization, and office-based ablation for heavy menstrual bleeding.
Endometrial ablation is a wonderful new option for patients with abnormal vaginal bleeding. One of the most common reasons for hysterectomy has been abnormal uterine bleeding, and patients really only had the simple option of hysterectomy. The good news is with an endometrial ablation, the patient is treated as an outpatient. An instrument is inserted through the vagina, through the cervix, into the uterus, and the lining of the uterus is burned away, reducing or eliminating all vaginal bleeding.
OB and GYN Specialists also offers non-invasive genetic screening for expectant mothers, reducing the need for amniocentesis.
NT and integrated screens are significantly more preferable to amniocentesis because, first of all, it allows us to screen a wider portion of the population. Amniocentesis had been generally reserved for people over 35 when they were going to deliver their babies, and now we can have a very sophisticated non-invasive test for all ages. Amniocentesis also carries a fetal loss risk and pain and bleeding and risk for infection. A non-invasive test like nuchal translucency and the integrated screen carries none of that.
Combining state-of-the-art technology and compassionate care, the physicians at OB and GYN Specialists are dedicated to providing successful treatments with minimal discomfort and recovery time. It's the combination of caring and effectiveness that draws thousands of patients to OB and GYN Specialists since 1977.
I was treated like a queen, I have to say. They were all so nice and so helpful, and they were very great. They were great.
For women, obstetrics and gynecology is a critical component of their health care. OB and GYN Specialists delivers the cutting-edge treatments that help women get back to their families and return to normal life as quickly as possible. For more information about our practice and physicians, visit www.obandgyn.cc.